Hi everybody, I'm Jason with Starlight Health. We're direct primary care here in Fort Collins, and today I want to talk to you about fatty liver. This is a very common diagnosis that I have seen many hundreds of times over the years, and it is traditionally considered to be a asymptomatic, benign type condition, and a lot of times people will diagnose it in passing. They will they'll do an abdominal ultrasound or a CT scan or something like that, and they'll happen to see that a patient has fatty liver and just kind of brush it off as nothing. And that's not wrong. In a lot of cases, in most cases in fact, fatty liver is very benign and doesn't cause any true issues, at least not in the beginning. But to truly understand what fatty liver is it's an invasion of fat cells, basically, into the liver itself. And if you think about that, it's not supposed to be there. And long term, it can cause destruction of the liver. It can progress to fibrosis and cirrhosis and things like that. And I kind of like to think about fatty liver as a precursor condition for most of the time. It's the beginning stages of what could become longer term issues. And I don't want to think about it as a benign condition, because there's actually versions of it that are completely not benign at all. There's another condition called NASH, which is non-alcoholic Steatohepatitis, which is basically where the fatty infiltration of the liver actually causes inflammation in the liver, which can cause severe pain. And I've had a patient with that before. So it's something to keep in mind. And also, it's reversible. So fatty liver, it can be treated, but there's only two major ways of treating it. The first one is if you have high cholesterol levels, you reduce the cholesterol levels. And the second one is weight loss. Weight loss is basically the only known treatment to get rid of fat cells from the liver. You have to burn those fat cells off. There's truly not really any way there's no medication that can target the fat cells in the liver. There's no specific way of doing it. You just have to burn the fat. So if you have fatty liver and you happen to be overweight, which traditionally, if you only get fatty liver from being overweight, you really want to burn that. You want to get rid of it, because over time it can cause failure of your liver. It can cause development of longer term liver problems and eventually can lead to more significant problems. And I like to think of fatty liver as not a benign condition, but a warning. It is a warning that you need to make changes now while it's still benign before it progresses to something worse. If you have any questions about that or anything in general, feel free to give me a call. I'm Jason with Starlight Health.